Ron, thank you. The members of the Pennsylvania Dental Association have their hands full right now, making up for all those missed appointments during the pandemic. They're calling the issues they're seeing COVID teeth.
But in the middle of all that patient care, they're also seeing a surge in people wanting to whiten their teeth. New this morning, John Shumway joins us with really some cautionary words about all this. Hey, John.
Hey, good morning. Whitening is pretty basic. You're putting a bleaching agent on your teeth to try and make them look whiter. But here's the incredible thing. There's a pandemic motivation behind this surge in whitening interest.
So many people are Zooming and they're actually taking a look at their smiles and they're like, oh my, I didn't realize my teeth were getting discolored.
So they're turning to whitening products.
In an attempt to get rid of stain or to try and brighten the enamel over time.
Is there a red flag or cautionary tale that you would tell people about doing it at home?
What happens is when you do it at home, the different products that are out there just aren't strong enough to break through a lot of the stain, everyday stain that you and I would pick up over time.
Which he says leads to impatience and overuse.
Some of those products, again, they leach through the enamel and they get into the next layer of tooth. It can affect the nerve of the tooth too and make things very sensitive for the patient.
And he says creates gum discomfort. He's also not a fan of whitening strips.
Because they have other ingredients in them that break down into different byproducts, I typically don't like to recommend those.
And Dr. Palowitz cautions home whitening can mask real issues.
I've had patients that have really tried to do a lot of home whitening, and it turned out that the stain was there for a reason. It was actually decay.
Yeah, and Dr. Palowitz says that there is no real regulation on a lot of these products, so you have to be very careful, especially if you're buying them online. Most dentists will happily whiten your teeth, and many have home whitening kits that they actually trust and recommend to their patients, guys.
All right. Okay. So I love my whitening toothpaste. Is there anything wrong with that?
Well, there's nothing wrong with it. He actually was kind of funny about that, saying it's marketing genius, because the toothpaste really doesn't have enough bleaching product in it to make that much of a difference. However, you know those little beads that are in the toothpaste, the silica, they almost feel like little things of glass? Well, they're actually polishing your teeth. So you're brushing more, and you're probably doing a better job of brushing. So really, you're doing the hard work to make your teeth become whiter that you might be able to have done with a regular toothpaste.
I drink too much coffee to not use it. I got to give it a try.
Now, I understand, and you've got a lot of company there. That and dark sodas do the same thing.
Yeah, well, it's good to know the whitening toothpaste is not a total waste of money.
Yes,
No.
that too.
No, and there's a psychological effect too.
That's true. Thanks, John.
Diving deeper now, John. Thanks so much.